What is treatment adherence? Treatment adherence is following the treatment plan your healthcare provider prescribed. For example, taking your medication correctly and following prescribed activities, like reducing stress, eating better, sleeping more, or other activities your healthcare provider prescribed. Why is treatment adherence important? Disruption to your treatment plan can cause your disease to progress or your symptoms to get worse. If your disease state worsens, this damage may not be reversible and could lead to hospitalization or even death. One estimate from the CDC states that non-adherence causes 30 to 50% of chronic disease treatment failures. Another study showed that 25 to 50% of patients taking statins who stop taking their medication have a 25% increased risk of dying within a year. Treatment adherence in biologics. Just like oral medications, biologics work best when taken on a schedule. You need to have enough of the biologic medicine in your bloodstream for it to work. Although you may be feeling better after a few treatments, you need to keep receiving the medication to maintain the right concentration of medicine in your bloodstream. Any interruption to your schedule can lower the effectiveness of your medication and may result in a disease flare. What are some reasons why I might not take my medications or get my treatments as prescribed? Cost. Prescription medications, especially biologics, can be very expensive. This burden can keep patients from filling their prescriptions or receiving infusion treatments. Side effects. Some treatments have scary or difficult to handle side effects. Trouble keeping track of multiple medications. Some patients are on multiple medications with different schedules. Confusion. Some people are not sure of the exact directions for their medication, such as exactly how much to take and how often. Insurance delays. Prior authorizations or mid-year formulary changes can delay access to medications. You don't feel a difference in your symptoms right away. Some biologics or medications can take months or several treatments before you begin to feel its effects. You do feel a difference in your symptoms. Once the treatment takes effect, you may feel great and think you no longer need your medication since you no longer have symptoms in your daily life. Fear. Medications have risks and side effects, but you are prescribed the medications because your provider knows that the risks and effects of not taking your prescription medication could actually be far worse. It is very important to make your doctor aware if you are having any of these issues, as they have resources to keep you on track with your treatment. Tips to boost your medication adherence. Set an alarm to remind you to take your medicine at the same time every day. Link taking your medication with a daily activity, such as brushing your teeth or eating lunch. Keep a calendar and mark off each time you take your medicine. Use a pill container and refill your container at the same time each week. Traveling? Consult your doctor if you are traveling during a scheduled infusion. If needed, you can use NICA's Infusion Center Locator to find a temporary center. Locator.infusioncenter.org. Check with your insurance to make sure they will cover your treatment at a different center. Keep your medications in your carry-on in case your luggage is lost or delayed. Prescriptions that are liquids and are larger than 3.4 ounces are allowed in carry-on luggage. You will just need to declare them at the TSA security checkpoint. Always bring an extra day or two of your medicine with you when you travel. If you are interrupted or delayed, you won't have to worry about running out of your medication. If you are traveling by air and you use a self-injectable medication, you might consider asking your physician for a letter of medical necessity. This can make your time during the security checkpoint run smoother. Here is a website where you can check if you're taking your medication correctly, and also offers tips to boost medication adherence. You're not alone. Your physician and pharmacist are there to help you through your journey. Have questions about taking your medication correctly? Never be afraid to ask your physician, infusion nurse, or pharmacist any questions you have about your medication. Are you scared of side effects or don't like the way your medication makes you feel? Always discuss your concerns with your pharmacist or physician. If the side effects become too much to handle, Consult your physician before stopping your medication. No question is too big, small, or inconsequential to ask your treatment team. When in doubt, ask away. It is much easier to stick to a treatment plan that you helped create. It is very important to be open and honest with your healthcare team about any concerns you have, so together you can decide what treatment plan will work for you. If you have other questions about infusion-related topics, check out NICA's education page, infusioncenter.org/education.